Everyone to the 8th Cannabinoid Science Work Group. Really excited for you to be here and for us to have a really great conversation. Just as a little bit of preview before we jump into our discussion topics, we're going to quickly review the minutes and get those approved for the one that we had in December, and that was sent out to you a couple months ago. So I just wanted to make sure there was nothing that anybody had seen from those minutes that they wanted to bring up in today's minutes. Okay, great. And then for today, I wanted to briefly have us start discussing two topics. So the first topic is talking about high THC. Is there a way to create a definition of high THC and justify that definition of high THC? And then the second topic is cannabis product stability across time. And obviously, these two topics are very complex. Oh, we have Ryan coming in. Hey, Ryan. Thanks for coming today.
Hey,
The second topic is, oh yeah, so both of these topics are very broad, and obviously we're not going to have enough time in this hour to really create a very solid understanding of either of these topics, but really it's to start having those initial discussions of your thought process and then what might be the best steps moving forward. So any questions before we move on to the first topic discussion? So I'm just going to briefly overview each topic discussion just in case anybody who is listening to this after the recording has a context and just for us to get all on the same page. So high THC has been receiving a lot of increased attention recently across various stakeholders, public health professionals, researchers, regulators, both within Washington and across the United States. And the primary point of discussion is associated that higher THC is associated with greater risks relative to lower THC. And this is particularly when we're talking about people who are at risk. So like people who have, developing brains, youth, young adults, adolescents, those with underlying health problems like people who have a family history with psychosis or who have mental or physical health problems as well. And yet this topic is and there's also research looking at medical and therapeutic effects of higher versus lower THC. This topic is super nuanced though, because depending on how you look at whatever it is that you're looking at, whether it's um, differences in THC concentrations, route of administration, how frequently you're using, there can be a lot of variations in what is determining higher versus lower THC. And across hundreds of studies, and this study actually looked at over 450 studies that examined higher versus lower THC, and they found that there was so much variability on the methodology of high versus low THC. And so in order for us to guide further exploration of this topic, guide whether there are policy options or where research needs to focus in on, it's really important to figure out what it is that we're referring to when we say high THC, if that's possible. So with that being said, these are the discussion questions that were sent to your emails. And I kind of want to start out with just a very broad question of, given your background and expertise, do you think that creating a definition of high THC is feasible? Yes, Jessica.
I would say I think one of the biggest issues I hear a lot is we have to be very careful when we create these definitions that we're not enabling a system where dilution leads to larger health issues. Kind of the vape gate situations where people are diluting products to meet certain categories. So, one of the things when you say, is it feasible for somebody to just put a number, a stake in the ground? It probably is, but is that the best for safety? I think that's one of the biggest questions in my mind is how do we enable people access to safe products and without creating more safety hurdles, if that makes sense.
Can you talk a little bit more about diluting, like what you mean by that and how that might impact public safety or health?
Yeah, so for example, if you were to say, hey, anything, and I'm just going to make up a number. I know that there's different numbers, but let's say that you were to say, hey, anything over 50% concentration is, high THC and banned or something like that. I think you would open up a system by which vape carts and things would still exist, but the question is what other dilutants would people put in those to meet that threshold? And so I would just say that that's we know in general concentrated floral material is from an inhalation perspective relatively safe. We know that when you put vitamin E acetate and different things in vape carts, that is not safe. There's a lot in between that. And when I say safe, I'm not talking about, studies about long-term effects or anything like that. I'm talking about immediate inhalation effects. And so my concern is that we really, is there mechanisms that we approach this via tax or different mechanisms that don't put people into situations that they're creating products that may have larger health issues than the ones that we're trying to tackle. Does that make sense?
That does. Yeah. Thank you, Jessica. Sarah?
So, what if we, I mean, I feel like defining high THC, like, what if we defined it as instead of like a number, but rather we could define it like as like a what people are using, like an oil, a wax, something like that is a high THC as opposed to like a flower, which would be a lower THC or something like that. Because when I'm working with patients, I feel like I try to steer them away from concentrates because drinking hard liquor is worse for you than having one beer if you don't know how to regulate those sorts of things. And so like I could like having it be more less of a number and more of like a substance based thing. I could steer people toward a lower concentration to try first rather than like a higher concentration without saying, well, go for the 15% over the 30, because I feel like we should avoid like labeling THC. People come into the shop and they're like, I want the one that's going to get me high. And I want to, like, as a healthcare person, I want to try to help people not just go for the one that's going to get them high, but the one that's going to help them the most. And maybe something like that would be a better way to define it. I know less about how things are made and more about how people are consuming them, but if we could do it in a substance-based way rather than like a number, maybe that would be helpful.
Yeah, Sarah, I think you bring up a really good point. And when looking at how people have previously defined um, high THC, originally it was kind of based on those product differentiations of like the concentrates are the ones that are higher high THC products. And I think there's also a further discussion within what you're saying is if theoretically you have the same amount of THC in one product versus another product, flower versus concentrates, would there be differences in like risk and safety profiles as well? And I also really appreciate your point of guiding legal users to what is going to give them the safest and most pleasurable, and avoiding kind of risks associated with that. Taylor?
Yes, couple things on it. I think from my perspective, because like in my research, I mean, granted it's mice, but I use a dose of 25 milligrams per kilogram, which would be comparable to 2,000 milligrams injected. And again, study the effects on the immune system. So for me, my definition of high THC doesn't even fit within this realm, because I'm looking at it basically from a toxicology standpoint outside of the immune function. So taking it back to humans, I almost view it as like a high THC would be per serving. Because I think the question is, if the goal of it is to have an actual health impact, what is the audience that you're targeting? Meaning, is it people that are not conscious of what they're buying to know how much they should consume? Because if you're looking at it from like a health perspective, a lot of things potentially considered high THC don't necessarily have a physiological harmful impact, theoretically, outside of, if there's pesticides or anything like that. But the actual, if we're just calling it high THC, that THC dose is probably not going to have a physiological harmful effect necessarily. So I really like the idea of THC per serving, because then it's kind of letting people know, if it's high THC per serving, say like one puff of a vape or, an edible or anything like that, it's kind of letting them know that this is a stronger product, and potentially keeping them from the mental side effects that would come along with a high THC dose, if that's really like the target audience. But yeah, I mean, I guess for me, a high THC dose is much higher than what most people would consider.
Can you, like, when you're saying THC per serving, can you go a little bit more into depth about what you mean by that?
Sure. So there's a lot of papers that have come out in the last 2 years that have measured potentially, like, using we have devices as well that can kind of mirror a breath, like breathing. And it can measure how much THC is being consumed per vape puff. They've actually there's a study that was using different voltage vape pens, and they found that most of the vape pens they tested were between 9 and 16 milligrams of THC per puff. You could also consider, I mean, I'm guessing you could use the same machine and measure per leaf how much THC is being consumed. Because the thing to keep in mind here is, if you're looking at health, the more of a product you have to consume, you're going to end up getting more of the byproducts. And that one paper you sent in the email, the second paper, they noted that when the users were using concentrates, they took half the number of puffs, and they were allowed to consume as much as they wanted. And there's another study they reference in their discussion that they saw the same thing during a study when they were allowed to smoke as much as they want, that people consumed half the amount of a concentrate. And although you're not feeling the THC right away, there are receptors like TRPV1 and other receptors in your lung that basically can signal that you've consumed a lot of a product. So there may be some sort of tie-in where, just because something's higher THC, the body may be like, oh, okay, I'm okay at this dosage. So there's kind of this evidence that's starting to emerge as they're doing more of these consumption studies, that a higher THC product may result in less usage just natively, even in an open use experiment where they can consume as much as they want. So that's kind of a highlight of the opposite side of the coin, where it's like, maybe some of these products don't necessarily result in a worse outcome if the user is aware of what's going on, which goes back to the serving. Someone may not know what's going on, go into a store and buy a concentrate, but if the little bottle said, 50 servings are within this, maybe that person would be conscious and be like, oh, I'm not supposed to consume half of this product in one sitting.
Thanks, Taylor. Ryan?
Yeah, those are really great points. And I think this, we're identifying this as a really super complex issue, particularly because of, we're just initially starting to talk about smoking versus vaping and sort of trying to distinguish between that. But, if we're really talking about from, increasing a health standpoint for users, edibles is the one that induces the most emergency room visits and is most likely to induce overdose. And that has really very little to do with how much THC. Well, I mean, it is how much THC, but it's their inability to self-titrate, like was just mentioned before, is like if you're using high concentrate products, the pharmacokinetics enable you to self-titrate in a way that is much safer in many ways than edibles. And so I don't know. I mean, in some ways, I think part of it is not just the THC, but like what Jessica says, like what you're mixing or diluting all of these concentrates with that really need to be heavily regulated. I don't see THC to be necessarily always the bad guy, but you know, it certainly can be. Anyway, that's all my point.
So, and Brad, I'm gonna get to you in a second. I'm curious about with the studies on titration. From my understanding, people tend to titrate, and there are other studies that showcase that even when people titrate with higher concentrated products, they have more like concentration in blood levels. Any thoughts or about that specifically?
I mean, I'm very close with my wife. Dr. Cutler does research and has worked with high THC products using a Zoom approach. I mean, you might be citing some of her work when you're looking at some of this stuff, actually. And so although she hasn't measured THC concentrations per se from the different methods of use, she doesn't see any greater, cognitive impairing effects from people that are using concentrates versus flower. It doesn't seem to really support that, at least at that level, from a behavioral or cognitive perspective.
Okay. Thank you, Ryan. Brad?
Thank you, Sarah. I'm going to echo a bit of what Taylor had to say and suggesting that it may be more feasible and perhaps effective to define high THC in terms of the amount of THC consumed or used over a period of time, rather than by defining it based on the product that the THC is in.
So when you're thinking about high THC consumed over a period of time, are you really speaking to providing guidelines based on, with research to support it, but based on, your level of risk increases based on if you're using X, Y, or Z amounts during the day or throughout the week, kind of like what we have with like standard drinks of alcohol with like 5+ drinks for binge drinking for males per night. Is that what you're saying, Brad?
And that's exactly what I'm thinking. That sort of the heavy use terminology used in alcohol models. I think that that's more instructive to folks that are looking to minimize their risk.
Thank you. Ryan, did you have your hand up?
No, I forgot to take it down from the last time. Sorry.
Well, it's kind of weird because sometimes when I raise my hand, Teams will lower it for me, and then other times it won't. I don't know if other people have that. I see something in the chat. Sarah, I tend to steer. Well, actually, Sarah, would you mind sharing what you wrote?
Sure. So as we were discussing, so when I have older folks that come in and they're having pain, and then they're asking me like, I went to the store and I didn't know what to buy. I steer them actually towards the edibles, that the gummy ones in particular, because they tend to cap their THC at 20 milligrams per edible. And I'm like, cut it in half if you want, but that way, if they take it at night and they wake up and they're dizzy, then they know that more is not going to be good for them. And so, because that's kind of a problem with the older, like the boomer population, that want to relieve pain and they don't really want to smoke it. They don't really know what to do. And so the gummy edible is kind of an easy way for me to give them a start. And so I like what people are saying, where maybe like the alcohol has different concentrations when people are buying it. And so Washington labels their alcohol like, if you drink, here's your limit, and if you drink this much and you go over this limit, then it's bad. So maybe we could do something like that instead, like on a package, like Taylor was saying, this is this many servings per package. If you take half the package, you're going to be pretty drunk or whatever, like, as opposed to having one serving. And that seems to make sense to me. And like a, layperson, like I went to the store and I didn't know what to buy.
Really, thank you. Jessica?
I agree, Sarah, and Brad, and what people are saying. And I think the one thing that kind of gets lost to some degree is concentrates aren't necessarily like a new thing. We know people have keeped this plant for hundreds, if not thousands of years. So we do know that there are certain ways that people have consumed this plant and not seen some of the issues that may be occurring now. And so I do think like education may be a good path, and understanding how much of something that people should consume and not necessarily potentially the format that it's being delivered in, as Ryan mentioned.
So speaking to that point, and Taylor, you mentioned this in your email to me. Alcohol is pretty standard because it's all liquid, but with cannabis, all of the different methods, and even someone's puff differs from another person's puff based on a variety of factors. So how, like, what, I guess when I'm thinking about it, that just seems very complicated to be able to determine or say, like, this is one serving when there are so many differences. Edible feels a little bit easier to standardize, but what about for smoking or vaping?
So I think
Ryan?
again, it would come down to kind of those studies that use the simulated breathing device and then measurement, which again are out there. And it kind of goes into that question of like, what levels are people willing to go into to kind of like push through some of these, I guess, policies. That would kind of be the way stuff would have to be tested, basically to see what the dosage would be, or relative. I mean, it's kind of tough. You wouldn't be able to test every product that way. But over time, there could be some sort of equation that summarizes it pretty well based on maybe viscosity of the liquid, based on THC content. You could kind of determine what the average puff would be. It is tough. I mean, again, that's where this gets so complex is how would that be calculated? And obviously within any of this stuff, anytime you come up with an equation or anything, people are going to figure out a way to get around it. So it is really tough. But again, going back to the alcohol thing, it's like percent solution is completely different than a dry weight percent. That's how, like in South Carolina, some of the stores here get away with selling very high THC product because based on the hemp law, it can be 0.3%, but that in solution is much higher than dry weight. So it's tough. But again, I think if you could figure out a way to calculate the per serving, then it answers the question moving forward. It's just getting to that initial point would be, the difficulty.
And we currently don't really have, and correct me if I'm wrong, but do we have a method of determining a serving size right now?
So I did a project on this at the clinic that I work at, and I took my pinky finger and said, so the top of my pinky finger is about 100 milligrams of flour, and 3 of those 4 times a day is like a ceiling limit for a dose, is what is because when people are smoking more than that, in my experience, they're not really getting any effect after that as much as they're getting like side effects more than anything. But like that's totally unverified, and I didn't use a tool to measure that. That's just kind of what I've seen in my practice over the years in an inhalation sort of thing. there's a lab test that I can order for patients that'll give them a number for like their blood concentration of THC. Like they can be like 114 or like 12 or something like that. And if there is, I don't know if there's literature out there that provides like you're impaired after this number, like 300 or something, but we could use that. It's like a definition for like an upper level of high THC. Like if you're going to use this product and it puts your blood level over, like, you know, in alcohol, it's 0.08. If it puts it over that, then we can label that as like high THC maybe.
Thank you. Ryan?
Yeah, I think the problem with that is, you know, we often want to equate blood levels of THC with intoxication or impairment, but it's not blood levels. Blood levels actually don't really correlate with cognitive or you know, any sort of impairment. It's brain levels of THC that you really need. So, I mean, just because you have a lot or a relatively little amount of THC circulating through your body doesn't necessarily mean that you're going to be more or less impaired or be more or less at risk of having adverse effects. And I'm worried a little bit about trying to draw too many relationships with alcohol, because I think that cannabis and alcohol are just entirely separate beasts, that we can't just say that a concentrate is the same as you know, drinking a, you know, 40%, you know, alcohol. It's very different, in my opinion, just based on the pharmacokinetics of smoking versus you know, drinking or eating something.
Thank you. David?
Yeah, Ryan said a lot of what I was going to say, kind of figured he would. But just to add to that briefly, a number of states had some values on the, or laws on the books that were based on values of blood levels. Most of those have been removed because they found that they were just not able to demonstrate any kind of connection, like Brian said there, a correlation to actual impairment function. There's a lot of data that's coming out very recently that suggests that their liver function is different in every individual. Liver function has a big impact on longevity of these compounds in the body and their impact. Individual BMI, or, you know, basically how fat you are, I hate to say it that way, but, you know, level of fat within the body has an impact as well. And all of those things come into play because those are tissues that are affecting the levels of these cannabinoids and their availability and the ability that they end up in the brain, like Brian talked about. Those are all very individual. There's nothing like alcohol is a lot. There is individuality there as well, but it's a lot more consistent in these broad categories. The data is that we're getting now from the clinical work that is coming out is suggesting exactly what Ryan said, that there's really no good correlation there. It's really hard to come up with a number that is going to work for people. We've got to, I don't know what the solution is though. I think it's going to take a little bit of time and effort to try to figure out what can we identify as some kind of quantifiable marker or something that, quote, connects a person's impairment with whatever their consumption level is going to be. And I think we're going to have a hard time coming up with a blood test, urine test, or anything like that, or breathalyzer or anything like that that's going to work. People have been trying to do that for a dozen years, and none of those things actually pan out. You see news stories about it, and they make, you know, they hype it. There was one just a few months ago where somebody claimed they had something again, and it's not going to work out. I look at it, it's going to be just like everything else people have come up with. It's really not going to lead to something that's really applicable in the field or even in a clinical setting. So it is. This is a really big problem, and I don't know what the answer is.
Yeah, I've also seen like I think what is the last, like the Druid that looks at like impairment, but I hear what you're saying and I agree. Jessica?
You know, one of the things that I think that's made this really difficult discussion at the legislature level is it appears, and even as part of our discussion, it's not necessarily the product by design is enabling like everybody to have an issue. It's just making it easier for certain people to have an issue. I think, you know, analogous to like a alcohol, a vodka is easier to abuse probably than beer, just based on volume. You can consume less, and that there's a lot of kind of educational deficit around the products at a consumer level. So I worry that by trying to approach it from like a definition of high THC, we may not be addressing the problem, which is really, that certain people are utilizing these products and having issues with them. And maybe the people having the biggest issues are actually the people that are misusing the products. And how do we help and education and like I'm not saying we don't address any of the product situation. I'm just saying, how do we actually get to this so that we're not creating larger problems and we're addressing the problem, which is that, certain people are being harmed by utilizing these products and maybe just by even misusing the products. So like, how do we address the issue, which may not be just a defining what high THC is, I guess is what I'm saying.
Hey, Jessica. Ryan?
Yeah, just to really echo what Jessica said, I think those are great points. And Jessica, you keep coming back to this idea of education. And I think that that's really the most important thing here. It's not necessarily setting a limit and saying, oh, we can't sell THC content above a certain level, because that's, I think that's not necessarily even quite grounded in empirical evidence yet. We don't really have the science to back up that even these just having high THC in and of itself is going to be more deleterious in terms of mental health or cognitive health outcomes. I know there are certainly some correlational studies that might suggest that, or there's some evidence maybe, but until the science comes out, I always feel like when we're trying to put a cap on things, or we're trying to prevent people from using things, it just creates alternatives for them to go and bypass the regulations. It's almost like you put something for that's like you're challenging people to circumvent the system in some way. And so in many ways, I just think, we all know that a lot of people are very comfortable with using cannabis these days. It's become a lot more mainstream and a lot less stigmatized. I think just now that we have so many more people using and more people are experimenting with it, we really need to emphasize just trying to teach people and educate people about what these harms actually are and what we know and what we don't actually know yet, because there's just a lot that we don't know. But, that's important when we're trying to make legislation. We can't just make legislation based on something that we kind of have a hunch on.
Thank you, Ryan. So we'll go with David and then Tracy, and then we'll move on to our second topic.
Yeah, real quick, I agree with everything about the education. The concern I have is, we always have to think, I guess, like the lowest common denominator is kind of what we have to look at here. A lot of people will become educated, but a lot of people won't get the news. They won't hear about it, especially if you've got children involved. And this is where, you hear about the stories where a lot of it's around Delta 8 lately, right? Kids that end up in the hospital because they get exposed. They eat a whole package of gummies or something that have 250 milligrams of Delta 8 in it. That was one that just happened. I heard about this last week. And little kids aren't going to be educated on this. So how do we deal with that? That's something that needs, I think that's what people are going to bring up as an issue. I know they will. So how do we deal with that? That's something that needs to be considered, is coming up with an answer to that problem.
Thank you. Tracy?
And just real quickly, I think that at least from my perspective, the state is a little bit conflicted about what its role is in terms of education. Washington was the first state to create the role of the medical marijuana consultant. And I've done some research on this as well. And there wasn't ever any kind of evaluation of what that role should be. Was it effective? Was the education that people were getting, did it do anything? And the default, that is the person that they're interfacing with. And the default for that is the clinician. And again, I've published research in this area. The clinicians are not comfortable with it, don't want to do it, think it's liability for them. There are educational barriers within the institutions to doing this work with the clinicians. There are barriers with the licensing boards. So I think if we want to talk about, having more education, we really need to understand what the state's role is in that. And I would start with that medical marijuana consultant role, since Washington does certify them.
Thank you. Right, Taylor?
I'll be real quick on this. The one thing I kind of that I think about sometimes in relation to this is like peanut butter. So there's a group of people that if they consume peanut butter, they die. There's kids at elementary schools, if they consume peanut butter, they die. Yet we still allow peanut butter to be sold in stores. So there is this concept that due to genetic mutations, people can be at super high risk for a product, where in the general public, the long-term toxicity is not that high. So there are but the difference is obviously this is sometimes viewed as a drug and things like that, but there are other instances where a product is readily available that in a select group of people with a genetic mutation can have extremely bad side effects. So again, if we're looking at it from like the potential role in schizophrenia or things, there are some things out there where a small group is susceptible in a way that other people are not. And that could be, it doesn't always have to be mirrored in the way of like alcohol or other substances. You can look at it in other ways of how people are distinguished in the use or consumption of an object, and how that's kind of looked at and regulated and discussed in the way that products say, like, if you made in a facility with the peanuts are housed, not necessarily putting those words, but just the concept that there may be other systems out there that could be mirrored or looked at on this topic.
Great. I think that was a good closing comment. Thank you, Taylor. Okay, great. So let's move on. We have about 20 minutes, so let's move on to the second topic on product stability. So the second topic was really brought out of a recently accepted rule petition to look at extending the expiration date of a certificate of analysis from 12 months to 18 months. And this petition has kind of brought attention cannabis product quality and safety measures. And within the past several months, there's also been questions and conversations about how various environmental factors like packaging and light can impact the cannabis product, the stability across time, and degradation. So, and obviously there are so many different factors like harvesting and drying and curing and transportation that can all impact the quality of cannabis products and the safety and how long kind of it's stable across time. So again, to further guide exploration in terms of what might be the best steps to move forward with this, these are the discussion questions that, again, you saw from the previous email that was sent out last week. So I guess just to kind of start off this conversation, when you hear about stability of cannabis products, what kind of initially comes to mind in terms of the biggest factors to pay attention to?
There is this, am I right in remembering that this is for flower only, the stability, or is it edibles as well?
That's a good question. I'm curious, when you're thinking about the differences of flower versus edible, if there are particular overlaps or differences between the two that you're thinking of.
In my mind, and I open others' feedback on this, I think they have different potential concerns, I would say. So I think that as far as like cannabinoid degradation, the cannabinoids are relatively safe. And I guess it becomes a question of whether the consumers are getting what they want in storage conditions. But I think there's a world in which people can store flour very safely for long periods of time, and quite frankly, edibles as well. I think the difference becomes kind of food safety concerns and expiration of other ingredients and things like that in edible formats. And so that's why I asked, is I think they just are different buckets as far as like mainly the microbial concerns, but I open it up to other people.
Thank you. Yes, you're specifically saying that they can both last for long periods of time, but with edibles, you're now entering other food products that might differ. Okay, which makes sense. So then specifically about flour, I'm curious, when you say long periods of time, can you give it a time estimation, generally speaking?
I think some of the literature I've seen is if it's cured properly and stored in a cool condition, a couple years, but open to other people that may have seen different literature. And a lot of it has to do with how it is stored. I know Brad has his hand. He's ran a testing lab in this space. He probably has more feedback on it.
Yes, please, Brad.
Thank you, Sarah. Thank you, Jessica. And my understanding with either flour or a lot of cannabis products themselves, that degradation generally doesn't create a hazard, with the possible exception of what Jessica was alluding to and talking about, which is some microbiological concerns. But in general, if you have degradation of cannabinoids, you might have a small amount of CBN or things like that, but you're not seeing the introduction of any of the contaminants that are being tested for in cannabis products. You're not introducing pesticides, you're not introducing heavy metals. And for me, if there's no hazard that's being introduced, there's no safety concern, and therefore there shouldn't be any concern with policy in terms of the length of C of A validity.
Thank you. So it's not so much about the safety, it's more so about like the cannabinoid concentration across time. Am I hearing that correct?
Yeah, and my opinion there is that any small changes that may occur don't present a hazard. So it doesn't change the safety profile, so therefore they don't matter.
Thank you, Brad. Sarah? Oh, and you're still on mute.
In my anecdotal experience, untrimmed flower on the stem can be stored for forever without having much of anything happen to it. And so like maybe putting more like looking at the way that people are storing their flower is maybe more important than finding out what happens to it later on, because it seems like not a whole lot happens to it, and we could maybe focus on, like, if the state is going to regulate something, they could maybe have visitors check out where people are holding their flower instead of trying to define, like, well, you can only have it for this amount of time and you can only do these things. You could say, like, is it in a closed unlit spot? Is it pretty much cool? Is it pretty much, whatever this, and then just kind of leave it at that, rather than trying to bring in any more complicating factors.
So then a follow-up question to that is, can you go a little bit more into detail about the specific storage factors that really play a large role?
Honestly, like, we have herb stored that's been here a long time, and it is still exactly the same as it was 7 to 10 years ago. It's just on its stick, and when we want to use it, we put it in a jar with a little bit of tortilla, and it opens the flower up and it's ready to use, and it's the exact same as it was 10 years ago when it was grown. So I feel like there isn't a lot of degradation, things happening, things changing with it that way.
Jessica?
I think that the things that you need to look for are kind of like heat and light. Light will lead to some degradation. Heat And, kind of things like humidity. I mean, it's a plant, if it's too hot, too humid, you can get things like microbial growth and those kind of things pop up on it. So cool and dark. David, I know you popped your head up, sorry, or your hand up.
Yeah, you cover what I was gonna say. Cool, dark, and dry is always best for everything. Can't always do that though, so the cooler, the darker, the drier is gonna be better for longevity.
Mm. Cooler, darker, and drier. Are there certain limits between cool, dark, and dry where you go from, that's, the more the better, but is there a certain limit where you're saying, okay, that's uh not good?
I haven't seen data for the types of materials we're talking about to be able to answer that exactly. To be honest with you, that's gonna take, somebody's gonna have to look at, someone's gonna have to experiment on that.
So then if
We heard from Sarah, I think Sarah's example here is a good one of what you kind of expect. Once you extract the compounds out, mix it with something else, then it all kind of changes. Then you've got, whatever else is in that mix is going to potentially affect it. But then you got Brad's answer, which was the cannabinoids are going to break down into things that are less active, more benign over time. So in terms of the safety issue, you're really looking at it like a food safety issue, like the WSDA, USDA deal with any other kind of product that people consume. That's really kind of the space you move into. With the cannabinoids, you're just going to be losing efficacy over time if they break down. It's probably not going to be an issue based on what everybody's saying. It doesn't sound like it's an issue with safety.
Thank you, David. Jessica?
I know that, this, to some level, I've heard from the medical community, there's concerns around how fresh their products are. And I would argue that it's really what's, how they've been tested, microbial and things versus freshness. Do we require a freshness date on it, or a harvest date? I forget. I think that got removed. Has that been removed from packaging?
Any policy folks from here want to clarify that?
Yeah,
From
that's
my
optional.
understanding,
It's optional right now. However, we do
That's
have a
optional.
petition to reinstate mandatory harvest dates on labeling.
Because one of the ways to approach this may be to put a harvest date on, and then people can choose whether it's important to them or not. And, that way, if we believe that it's, minor degradation or something like that's going on, but it will be safe, that people could opt to purchase older flower if they want. But they have the option of kind of knowing the date of flower if they choose to purchase newer flower.
As long as the product, as the consumer, as long as I would know that that product was stored or held onto in a certain way after its harvest and then before it was given to me in the store 2 or 3 years later, like I would be fine with that. Right now, I'm not sure, like, is all that product trimmed and then sitting around and then it's going into my bag like 3 years later? Like I would have a different feeling about buying a 3-year-old herb that way than if that the person, the factory person had it hanging, in a little closet for forever until they pulled it out to trim it, to put it in the bags, to have it be sold in the store 3 years later. Like, I feel like that's too, it's different. It's different. The way it's stored makes a difference, I guess.
I agree, Sarah, but you as a consumer would then have like the option to select which one you purchased based upon having that information, that date available for you.
Yeah, I mean, as long as I like had the reassurance that that was stored properly before it was sold to me 3 years later, I wouldn't care, I guess, as the consumer. But if I didn't know how they stored it and, it's sitting out in their back patio for 3 years until they decided to bring those baggies into the store, like, I feel like that would be different. situation.
Tracy?
Thanks. Just a question. I don't understand much about the literature on the degradation of the other products that are on the list. And I also know that at least in Oregon, I'm kind of between Oregon and Washington, they can't pull products based on dates. They're just supposed to sell them in order. So there's no option to like request or look at that date.
Interesting. So I'm curious then, harvest date would help people become more knowledgeable about the harvest, but what, like speaking to what you were saying, Sarah, in this, an ideal world, if you were looking at a product and it had a harvest date and then it had information about storage, what would you be interested in seeing?
Like if it said like product was stored according to standards of, Washington state regulations or something like, and then
Okay.
we could, as a body, like make sure that these products are being stored according to the way that we think they should be stored. I mean, that would make sense to me, I guess.
Any other thoughts related to that?
I think it would be easy, especially did you offer something that is as an opt-in, and then if growers or producers just opted to not opt in, they wouldn't have to, but as a consumer, then you would be able to purchase product that had had the ability to opt in.
I'm sorry, opt into
Storage conditions. I
Oh.
think that there could be different just like you could opt in to be an organic farmer, people could opt into grain to store in certain conditions.
Thank you. And then to what Tracy, you were saying, when we're thinking about like concentrates, is it kind of the same with kind of the stability of how it's stored and degradation across time? And maybe again, what Brad, you were saying, that like the cannabinoids might change slightly, but there's not really any other health or safety risks associated with concentrate storage. Tracy, I see your mouth, but
Sorry,
yes,
yeah.
no.
I'm going. Or topicals, I know that that's not really on this list, but if they're losing efficacy, then I mean, to me, that is a regulatory issue if people are continuing to sell something that's supposed to be effective, that and there's no control over the dates. Some of these things are just sitting there for years.
Yeah, that's a great point. Thank you. Brad?
Thanks, Sarah. Compared to flower or plant material, concentrates generally are much more stable. They benefit things that David was saying, cool, dark, and just keeping things that way. But generally, concentrates are much more stable than flower. And the same applies, that if there is any degradation happening, it does not appear to be introducing any sort of hazard. So there's not a safety concern that's being caused there. There may be an efficacy or a freshness issue, but it's not a safety issue.
Right.
Have you seen anything about topicals related to that, Brad?
I have not, no.
I found unadulterated flour to be very stable. If it's just chopped and hung, it stays exactly the way it is until it's manipulated.
Great. Any other last thoughts on this topic? Okay. So just as a quick recap, from these conversations from the first topic related to defining high THC, my takeaways are right now there's so many factors that creating this strict definition of what high THC is might not be feasible because there are so many factors that influence kind of how much THC is being entered into the body, and then whether and to what extent that produces risks for individuals, both on the short term and on the long term. Education is super important to provide more education that is evidence-based, potentially looking at heavy kind of factors related to what is considered heavy use. And frequency of use across time, and then potentially also looking at whether there's an ability to talk about servings per container based on vaping and smoking and edibles, although that's also very complicated. Is there anything that I missed or that was another important piece that should be a main takeaway here? Okay. And then for the second topic, my main takeaway is that in general, across time, if these products are stored in a cool, dark, and dry place, these products last for a very a good amount of time, and there's not really any specific safety risk that can come from it. There might be slight changes in cannabinoid concentration, but other than that, if it's stored properly, then there is a long period of time in which these products are stable, and providing more information about harvest date and potentially storage factors that went into a product might be helpful again for increasing consumer knowledge. Is there anything that I'm missing there? Okay, great. Well, thank you so much. I will, if anybody has any additional thoughts, please let me know. Otherwise, this has been a really great conversation. I'm realizing that, has this shared screen been, were you still able to see everyone through the shared screen? Okay, great. Let me stop sharing. Great. So I know that it's time. Any considerations for next steps? If not, then we'll kind of take this information, consolidate it, and we'll kind of go from there based on other conversations and these conversations as well. Okay, great. Thank you so much, everyone. I hope you have a good rest of your day. Appreciate it.
Thank you, Sarah.
Bye.